Governor, the CDC's advisory panel meeting this afternoon. When do you anticipate getting final guidance from the CDC so you can finalize the state's plans for rolling out the vaccine?
What do we anticipate getting from them?
When do you anticipate you will get that so that you can finalize the state plans?
Our hope is that they'll be finalizing their work and distributing it to the states in the coming days. Obviously, as soon as they are able to deliver that, we'll be able to take that into consideration in the way that we prioritize how the vaccines will be distributed across Illinois. But let me remind you that the vaccines that are on their way, potentially, if the EUA is approved by the FDA, are potentially coming in the middle of December. And those vaccines, because of the limited numbers of them, will go almost all to healthcare workers, and if there are enough, then next to those in long-term care facilities, the staff and the residents. But our anticipation at the moment is the numbers are small enough so that it won't go beyond those two populations and may not even get to all healthcare workers, at least not in that very first shipment that we receive.
Do you have an update on just how many doses the state is anticipating?
I'm glad you asked the question about the update, because truly we get information every day, new numbers. They change every day from the CDC and from the FDA about how many doses will be available. Right now, it looks like, and this is as of today, and tomorrow it could change. Right now, we've been told so far that there may be 109,000 doses, which is about 54,500 people, because there are 2 doses per person. So that's the very first shipment. That's not all that we'll ever receive. That's just what they are telling us today we would receive when the first shipments are made. I am hoping that we'll get more. I'm hoping that number doesn't change, but we're at the whim of the FDA and the CDC and the federal government as far as those first shipments.
Yeah, it's my understanding, just from reading the website, that the same sort of distribution infrastructure that's used for the flu vaccine every year for child immunizations is going to come into play here. Is that accurate? Is that enough? Is that robust enough?
Well, it'll be slightly different, if I may say, because these vaccines that are coming in December and in January have not been approved for children. They're only approved for adults. So there are trials going on, and that will go on over the next couple of months with regard to children and the impact of these vaccines on children, the dosage that's right for them, and so on. But this first shipment, anyway, and these first several shipments really are aimed at adults.
Follow up just on the vaccine, if I could, Governor. Dr. already said today that she does not anticipate Chicago will have any kind of mandates for vaccinations. Where does the state stand on potential mandates, and if there are any, who might be part of that?
Yeah, there aren't any mandates in place. It's certainly something that as you know, always is under discussion. What I know is that we're going to be focusing on those populations that are most vulnerable, and also the people who treat the most vulnerable, not just healthcare workers, but others who may work with the most vulnerable. And so, essential, we've sometimes called them essential workers. We want to make sure that they're vaccinated as well. But there are not currently any mandates, but we will look at what the history of vaccinations has been, and what populations you might require vaccination within, and evaluate that in the context of these new vaccinations that are coming in.
We'll do one more in the room, and then we got to get online.
Obviously, healthcare workers are prioritized. Will the vaccine go to counties based on population, or based on virus burden, or all of the above?
I think I want to turn that over to Dr. Ezike, because she is steeped in it every single day, and I only get a report every other third day.
So there are many considerations. Of course, everyone has heard about healthcare workers being at the front of the line. There are so many people that are high priorities, and we have many of my team members are on the call right now with the Advisory Committee on Immunization Practice, the ACIP meeting, which was it's going on right now. It's a 3-hour meeting, so we'll get a lot of information in terms of if they're going to recommend some different prioritizations. what they had established as the groups in August, there may be some reorganization. Again, understanding that we don't get to the end point until almost everybody is vaccinated. So it's just a matter of, it's not whether you're in the 1A or the 1B, or if there's a 1C or a 2, everyone needs to get vaccinated. But understanding some of the trends that we've seen already in terms of who has had the worst run with it, whether it's the certain communities, whether it's certain ethnic populations, whether it's certain age groups, whether it's certain people with certain medical conditions, trying to figure out how to put that in. I don't even think it means that, this person is more important than this person, but just understanding and appreciating that there are certain really high-risk groups that we need to focus on giving it first. And just getting those high-risk individuals, people who are involved with the public all the time, who work in the ICU doing procedures that can cause the virus to spread in the air, or the person cleaning the room of the COVID patient. All of these are high-risk people, people who make sure that there are foods on the shelves in the grocery stores and are in contact with lots of people. All of those are high-risk people. So just understanding that, everybody needs to get the vaccine. There are a lot of people who are essential or critical to making sure that life can continue. And so there will be a lot of information that will be ascertained from the meeting today. We will continue to put that into the plan, but we absolutely will look at areas, regions that have had large number of deaths per capita. We already know that African Americans are most likely to die. So weighing all that in, of course, there's never going to be a perfect equation to make that, perfect. I don't think there is a right answer, but we are very intentional and looking at all of these issues. And again, this is not a one and done that we get that first allocation, hopefully, if everything goes well, sometime in December, and then we go. We're going to have months of trying to get this vaccine out, and we will continue to adjust. We'll be following the data and the metrics to see who has been immunized, who has not, which parts of our senior population have been immunized, and then we will, it's a supply and demand thing, right? So we don't have enough for everyone to get it. So we will just be adjusting the distribution and the allocations to try to get as many of those high-risk people up front, but knowing that the goal is to get it to everyone and hoping that there is going to be the will of the people to actually receive it. That's another important part of this.